Hi, my name is Mohammed, and today I'll be talking about a common problem we have in our society today, and that's access to healthcare. So what is the problem? Well, the problem is that people don't have access to healthcare, and the reason that this is a problem is because the best way to treat a disease is to prevent it, and access to healthcare is a crucial way to not only stay safe individually, but as a community. Our health is greatly affected by the people around us, and we're exposed to whatever they're exposed to. So what are the factors of not having access to healthcare? Well, there's lack of insurance, not being able to pay for medical expenses, our community or the place we live in, our socioeconomic status, or just plain misinformation that we might read from some random internet article or on the streets. So the first thing I wanted to talk about was health insurance and the access we have to it. The reason that health insurance is important is because it determines the cost of our health care, and it incentivizes us to seek health care if we have access to health insurance, and it de-incentivizes us if we have to pay out of pocket. So the benefits of health insurance. Well, the first and most known one is that it covers the majority of health costs, and all you have to pay is a monthly premium and a copay whenever you visit the office. Another benefit is that you have access to resources such as a primary care physician, as well as access to specialists within the insurance group, which is also important because it gives you specialists that you know are covered under your insurance and you know you don't have to pay out of pocket and you aren't hesitant to see. So what's the problem? The problem with that is that amount of people covered by health insurance has actually decreased in 2017 in comparison to 2016, despite the Affordable Care Act being in place. And just to reiterate, the advantages of having insurance is, like I said, the low cost health care, our primary care physicians, who are also very familiar with you because they only see you and you don't go to a bunch of random doctors who only see you once and don't know your actual story, which is very important. And that they also act as gatekeepers because they sometimes we don't know our own bodies and we need help seeking the right assistance, and they can lead you to the right specialists. And like I said, they refer you to people within the insurance group, which is important because people don't want to pay out of pocket for something they pay for already in insurance. Another big advantage of having insurance that people sometimes oversee is wellness programs. Well, wellness programs are sometimes thought to be like ways to get out of seeing a primary care physician. It also instills a healthy lifestyle in people, and it promotes good eating habits, regular exercise, good sleeping habits, and it's just a good way to improve your health overall. So another factor I wanted to talk about on access to healthcare was socioeconomic status. And the problem with this is that a majority of people who are uninsured are actually working age adults. And while Medicare and Medicaid help elderly people and people with a very low socioeconomic status or disabled, they don't help people who are borderline low status. And the problem with this is that people who are low status are still having to live check by check and are having problems putting food on the table, and they're completely not focused on paying for health insurance more than putting food on the table. And this actually greatly de-incentivizes them to go seek out healthcare when they're experiencing severe complaints like chest pain, or they might be having a heart attack, but they're ignoring their symptoms because they don't want to pay out of pocket for a huge medical expense like a hospital visit. So what are some possible solutions? Well, the biggest thing is that the government has to step in and help. And the best way that they can do this is by holding public health events. And the reason that this is important is because educating people, at the very least, can help prevent common chronic conditions like heart disease or diabetes. And educating the public on health concerns and also promoting good lifestyle choices is a good way to do that and a good starting point. Another way is in funding volunteer clinics. And by funding these clinics, we can allow for quick checkups, whether they be just simple pregnancy tests, STD checks, or annual physicals. These can help in preventing disease and allowing people to know where they are at a medical standpoint. While all these solutions I suggested sound great on paper, we still have a lot of problems we have to solve before we can even think of universal healthcare. Like take for example the cost to run those volunteer clinics and public health events I suggested earlier. Governments only have a finite amount of funding and can barely keep these clinics and public health events running for that long. And another thing, areas of lower socioeconomic statuses generally lack all types of medical assistance and healthier choices just in general. Take, for example, the lack of parks or OB clinics where women who are trying to become pregnant or who are already pregnant don't have access to healthy pregnancies. Or we could look at it the other way and look at how these places have increased amounts of fast food places, but have decreased markets where they can get fresh fruits and vegetables. And the big thing is that improving healthcare in such a small space doesn't help at all. We have to take this more at a global approach because we are exposed to whatever someone else is exposed to. And the only way to have good healthcare is to address everyone's needs. So to wrap up my presentation, I'm gonna quickly go through what I just talked about. So access to healthcare is very important because the best way to treat a disease is to prevent one. And the best way to have access to healthcare is access to insurance, which greatly increases access to healthcare. Socioeconomic status also greatly affects access to healthcare because not only helps you pay for medical expenses, but it also determines the type of medical care you can get sometimes, depending on where you live, what community you're in. It could affect the types of clinics that are available to you. And the last thing I want to touch upon is that the best way to help those in low socioeconomic statuses is to increase education and awareness of public health concerns. That concludes my presentation. Thank you for listening.